Well, there's a lot for the government to consider, and it is pretty evident that tackling the problems highlighted in the report into the health service is no small challenge. Well, earlier I spoke to the Health Minister Stephen Kinnock. Thank you very much for being on the programme tonight. Well, the Darzi report has obviously laid bare the challenges in the health service, but to be honest, if you've been to A&E recently or if you're trying to get a doctor's appointment, you probably don't need a report to tell you about the challenges in the NHS. So I guess my question to you is, we know the problems, what are you going to do to fix it?
Well, thanks very much for having me on the show, Sophie. And you're right that Lord Darzi has given us a raw and honest assessment of the state of our health and social care. And he's clear that it's in a critical condition, and without major surgery, it will die. So this is urgent, it's critical, and we've got to get to work on it, and we are getting to work on it at pace. I think there's two answers to your question. One is, what are we doing in the short term in terms of the crisis management that needs to take place? And that's about the 40,000 more appointments in the NHS that we're putting in. It's about the 1,000 new GPs. It's about the 700,000 new dental appointments. They're all manifesto commitments. We're working on them right now as we speak. Then there's the longer term question about what we do in terms of reform, and we are bringing forward a 10-year plan for the future of health and social care, and it's going to be based on three major shifts: from hospital to community, from sickness to prevention, and from analogue to digital. There's going to be a big national conversation going on over the coming weeks and months, and we're going to publish that strategy in the spring.
Now, you might disagree with this, but, listening to Keir Starmer's response and Wes Streeting's response, it feels to me like you're almost cherry-picking parts of the Darzi report, because, yes, there's criticism of the Conservatives, yes, there's a call for reform, but he's also pretty clear that the NHS does need more money. He says that there's a shortfall of £37 billion of capital investment, which could have rebuilt or refurbished every GP practice in the country. It could have paid for 40 new hospitals. And instead, he said, we've got crumbling buildings and parts of the NHS operating in decrepit porter cabins. So are you going to fix that £37 billion shortfall?
We're very clear that the investment and the reform, they're not either or. It's both and. The two have to go hand in hand. There's absolutely no point turning the taps on.
Are you going to address the shortfall in capital investment? I'm not talking about general NHS spending, pouring money into failing hospitals. Lord Darzi is very clear. He's talking about investment in equipment, in scanners, the capital investment that keeps being sucked out of the NHS.
What I was saying was you should never turn the taps on until you fix the plumbing. So the reform piece of this is absolutely vital. But on your specific point about capital, the Prime Minister was clear today. Labour is the party of the NHS. We founded the NHS. We will always stand up for the NHS and provide it with the investment it needs to ensure that it is free at the point of need. What we have seen is massive underinvestment in capital. And pouring money into a system where the clinicians and the other staff don't have the tools they need. It's a bit like British Airways hiring loads more pilots, but not giving them any planes to fly. So we absolutely have to look at the capital budget. We've got to fix the fact that we've got RAC in so many hospitals. I mean, we're dealing with a crisis. We've got to look at that in the round. But the future of capital investment will absolutely be part of the 10-year plan. But don't forget that the shift from analogue to digital is also a really important part of this. Imagine if we had an NHS app that actually worked, where you could book your GP appointment and do whatever you needed to do with your local health service. And that would save so much in terms of productivity, efficiency, and indeed kit and equipment that we might need. So let's not just think narrowly about capital investment. Let's think broadly about this shift from analogue to digital as well.
I just want to ask you finally about an interview I did today with Andy Haldane, who's the chief economist at the Bank of England. He thought there should be more money in the NHS. He also said to me that he felt the mini fiscal event in July, the black hole event, was, in his words, unnecessary and probably unhelpful economically at least. It's one thing to reveal a black hole, if that is indeed what it is, but just leaving that to sit for 3 months, I think, was a bad idea. What's your reaction to his words?
Well, we were elected on a manifesto that would have two major commitments in it. One was a commitment to change, and we're talking today about how we're going to change our health and care system. And the other was fiscal discipline. We're going to build growth and a new economy with public services that are properly funded on the foundations of fiscal discipline and sound public finances. And it is frankly outrageous that the Conservative Party left us with a £22 billion black hole without the reserve spent 3 times over. So it's absolutely clear that we needed to take remedial action on that. We've had to take some tough decisions, but if we can get that stability into our system and into our economy, that is what's needed to attract investment, to build growth, and to fix our public services. And that is what you're going to see from this government in the coming weeks, months and years.
OK, thank you very much indeed.
Thanks, Sophie.